Croeso, welcome. So this is Back Care Basics with me, Rachel Beyonce Hubbard. Can never get bored of that name. And this is all about the spine and hopefully something to help you understand about how the spine works and how it might help you in your Pilates classes. Okay, so here's the spine to begin with, and you can see here how the spine is straight from the back, but when you look at it internally, it has these curves here. So you've got a curve at the top, at the neck, curves outwards where the rib cage comes on, curves inwards on the lower back, and curves out over the pelvis here, and then tucks under onto the tailbone. So at the top, you've got these two bones, atlas and axis. And what happens is your head, can you see that flat bone? The head sits onto that, and that has rotational capacity. You've then got the 7 cervical bones all together. You can see how tightly packed they are, but also you can see how long the transverse processes are at the back, and that's to allow good strong muscle attachment. So lots of the muscles of the shoulder attach onto this part of the neck area, which is why sometimes when you're tense you get a lot of pain in your neck. Okay, then we come down to the thoracic. And again, you can see how the spines stick out at the back for these muscle attachments for the spinal muscles. And then you've got the processes out to the side as well, which have some attachment. So T1, thoracic 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Now T12 and lumbar 1 have a slight rotational capacity, and you can see here how you've got shortened transverse processes to allow that to happen. Moving down the bottom, you have the lumbar spine, and you have 5, L1, L2, L3, L4, L5. So you quite often get problems between L4 and L5 or L5 and L6. And this tends to be where we see most lower back problems, not exclusively, of course. Now you'll notice again, look at the size of the transverse processes here, and that will tell you how many muscles and how strong this back has to be to support them. The muscles will also attach onto the side processes here, and then you'll notice how the lumbar spine sits onto the sacrum. So the sacrum is formed of 5 bones, okay, S1, 2, 3, 4, 5, where their bones are fused together. So think of it like melted together to make like a shield. Now, where L5 sits on S1, we quite often get problems as well. And those of you who have sacroiliac problems, okay, so here on the edge is where your hip will join onto your back. And this forms a joint here, part of the sacrum and the iliac crest, so making the sacroiliac joint or SI joint, you quite often hear it spoken as. And then you come down to the coccyx, so you can see the coccyx down here, 4 little bones fused together. And this is the main attachment point for your pelvic floor muscles. So the pelvic floor muscles here work with the spine, yeah, to support the lower part of your body. Now running on the inside here, you have a long ligament that runs the whole way down the inside, and sometimes this gets very tight and stops flexibility in your spine. Okay, so this is the disc. So quite often people talk about the spinal disc. So this is taking like a look at where you have one vertebrae here are the transverse processes here, and here's the spine here. Now in between here and where you see the internal part, okay, so if you go back, let me go back, okay, you'll see the spinal cord running down, and here you'll see the nerve coming out of the spinal cord, yeah, and you can see sometimes when you get a pinched nerve how that pinches here. So the disc here is used as a kind of a ball bearing to allow the spine to move quite freely. And you can see it's made up of 2 different parts. So it's got a very tough, fibrous outside part, and then a more jelly-like inside part. And this tough outside part is really strong, can cope with compression, and the jelly-like part allows your spine to move freely. There's lots of ligaments supporting the spine, so don't think there's just muscles. So you've got some muscles and ligaments here. So between each of the small transverse processes on the side, you'll have these ligaments here. I've already told you about this anterior longitudinal ligament, which often gets very tight. I find this one's quite problematic with people, but also you've got one on the inside here. It's not as large, okay, so this posterior longitudinal ligament, but also then wrapping around, so as well as between each of the processes, wrapping around the back here, you've got another set of ligaments. And all together, you have a very strong joint. You even have ligaments wrapping between one vertebra and where it joins onto the next one. So let's have a look at the muscles of the spine. And I love the muscles of the spine. So here's the spine, as we talked about, and here's the pelvis. Okay, so the pelvis, so that was the sacrum, yeah. And you'll see, here we go, latissimus dorsi, and we've got trapezius. So if you look at trapezius, very interesting muscle, starts, connects initially at the base of the skull, connects to each of the cervical bones of the neck, but then comes across and attaches onto your scapula, and then attaches onto the thoracic spine all the way down to T12. And this is called the diamond-shaped muscle, okay? And you'll notice where the fibers are running, yeah, then that's the way your back muscles contract. So they can only contract along the length of their fiber. All right, so that will pull your shoulder blade up towards your ears, but also this will pull your shoulder blade down towards your lower back. So the muscles and the ligaments work together to support the spine, and they control movement when you're resting or when you're active. Now you'll notice this is called muscles are striated, so they look a bit striped, and that's because of the two proteins actin and myosin. So there's more than 30 muscles here, and tendons and ligaments to be able to balance out the spine. And if you'll see, you have different types of vertebral muscles. Now, some of these muscles will move the spine sideways. Some of these muscles will move the spine into hyperextension. Some of these muscles will move the scapula. The muscles that move your spine and curve it forward are, of course, your abdominal muscles. So this one we quite often talk about. So this is multifidus. Multifidus is one of the key stabilizers of the core muscles. And what it does is it stiffens this lower part of the spine. So when you're doing your, say, your swimming exercise, we're working transverse abdominis. So transverse abdominis will sit against the lumbar spine here, wrap around the edge of the iliac crest, yeah, attach through the middle into the fascia. And as it contracts, what happens is that this muscle, and you can see it in a zigzag fashion, contracts to hold the spine still so that the spine doesn't move. Okay, and you can see the way it works, like a little bit of crochet all the way down the spine in order to stop the spine over moving when you're doing core work. Quadratus lumborum, this is my favorite Harry Potter spell. Okay, so your QL muscle is one that gets notoriously tight. So its attachment point here, it starts here onto the lumbar spine. So you can see, now look, it attaches onto the bottom half of the rib. So that's when we lean over to the side, yeah, we try and increase the gap between the rib and the hip. Okay, and we don't try and let the hip move at the same time. And then it attaches onto the spiny processes or the transverse processes of the lumbar spine. But look at this one actually attaches into the spine, and it actually attaches onto one of the disc areas as well. And if you think of it, this is like guy ropes on your tent, and what they do is they stabilize lateral movement, okay, sideways movement of the spine. When it contracts, it will pull your rib down towards your hips. So when you bend to the side to pick something up, yeah, but also you want it to be nice and flexible, so when you reach your arm up, that you can increase that gap between your rib and your hip. Okay, so we talk about the abdominal muscles, And I think this is a good way of showing how it works as a girdle. Okay, so here's the spine with all the muscles around the spine. Now your transverse abdominis contracts this way around, okay? So it comes like a circle and pulls your abdominal muscles towards your back. So if you think about maybe having strings here and gathering your muscles, that's what transverse abdominis does. Then you've got your externally internal obliques, and they are helping to move the body side to side, yeah, or across, so shoulder to opposite hip. And then you've got rectus abdominis down the front, and what they do in particular is stiffen the front part of the body, compress the rib cage, and stabilize rib to pelvis movement. So neutral spine is what we call the first step of lumbar stabilization. It's biomechanically sound, and it decreases the tension on your joints. So, you know, when we do a posture check at the beginning and I say, like, go into normal posture, and can you feel aches and pains? You have to be quite strong to hold your posture. And sometimes if we're continuously out of posture, then we're continuously stressing the joint out of position. There's different forces on the discs and the vertebrae, okay? So you can't just work one muscle. So in Pilates, you tend to work a series of muscles in a flow, which is supposed to mimic, you know, natural everyday movements. And also you then stretch the muscles, because sometimes muscles are tight and then the opposing muscle can't stretch. And you need to think about making that powerhouse. So I talked last week about the powerhouse. So your center area is strong so that you can change and move position. Okay, so it provides the greatest functionality if you are strong in the center. So here we go. We quite often go through these posture checks. So your ear should sit above your shoulder. Your shoulder sits above your hip. Your hip, this is actually wrong, sits behind the back third of the knee and then over your ankle, okay? So to stabilize your spine, you need to be able to align your body to stabilize it or hold it, but also to control movement. So when we talk about, you know, Punjab's theory, the aligning is the neutral position of the body, where we just move in the bones into the correct position. So before we start, we align all the bones correctly. Then we want to stabilize or hold position, yeah, with the muscles, and we control movement through really small little contractions and guidance between the nerves and the muscles, so neuromuscular control. And it's the flow of movement that makes it important. So as humans, we're always moving. So you want your spine to be controllable in lots of different positions. And it involves all three areas, okay? So you have to look at your nerves, your ligaments, your muscles, your tendons, the skeleton. So some of the common back conditions we see tend to be down to poor posture. So where we are deconditioned and the muscles are not aligning the bones in the right position, they are not controlling the movement, and they are not stabilizing anything. Or you have poor posture and then you try to load up your spine with weight. Being unfit is just to do with the condition of the muscle. So you don't train the muscle, you have less muscle tissue, you don't nurture your muscle with food. And being inactive is linked to being unfit, which links back to being poor posture. Or you might have an injury, so you might be perfectly fit and able and you fall over skiing and you hurt your back and it's never quite the same again. You can have disc problems. Spinal stenosis is where the gap, you know, where we saw the spinal cord, so the spine, one vertebrae to the next, moves or slides into position and pinches the spinal cord, which is not good. Or you can get arthritis. So most people tend to get arthritis as they get older, but there's no reason why you won't get arthritis in your spine. And then you can have something called spondylolisthesis. And spondylolisthesis is the sliding movement of one vertebra against another. So it's like a shear force where the vertebral column slides towards the internal part of your body. And then you can have osteoporosis. So osteoporosis, we talked about this before, is the thinning of the bone, where the bone itself starts to disintegrate. So instead of having a strong structure, the structure of the skeleton becomes weak. So let's have a look at some of the more common postural imbalances. Now, they're not exclusive, but they're the most common. So here we go. Kyphosis used to be called the dowager's hump and tends to be a more common postural problem in people who are fairly sedentary. And what happens, this is probably too many years of sitting on a computer with your head leaning slightly forwards, and you get this lump here. And this is because the spine column here has come out to position, and it tends to be because the weight of the head is too far forwards. You have weak abdominals, okay, so you can't compress and push the spine up. You have weak back muscles, so you can't hold the spine into position. Lordosis is then the other way, where you have weak abdominals, but the spine has moved inwards too far, and you can see how much pressure is on these spinal area here. Scoliosis tends to be more genetic, or it could be brought about by sitting awkwardly every day, where you've pulled one part, I mean this is quite severe, pulled one part of your spine out of position. Okay, so here we go. Here's the normal vertebra, yeah, with the transverse processes here, and here's the space here where you'd have the spinal cord. So a normal disc would sit neatly between one vertebra and the next. Now this is a degenerated disc, and this tends to be age related, but also nutrition related. So if you don't eat food with goodness that nurtures your body and provides sufficient vitamins and proteins to repair, you're more likely to have degenerated discs. Also by not exercising. So when you exercise, if you think about moving your back here, you kind of have a little bit of a suction effect on your spine and keep it nice and moist and gooey, rather than sitting still and constantly having a downward force of gravity pushing down. So being inactive accelerates degeneration of discs. Now this is called a bulging disc, and this little bubble is, do you remember the jelly part? So the jelly part pushes outwards into this space. Remember I told you this is where your spinal cord runs. So if you can imagine your spinal cord is in here, then you're going to get radiating pain as the bulging disc pushes against this. Now, once you do have a bulging disc, it doesn't mean it doesn't come back to this. Okay, so sometimes you have a bulging disc. It might be through injury, it might be through poor posture, it might be through prolonged periods of sitting. You can even have a bulging disc if you're fit and active. Okay, so it could be an injury related. And this is now a herniated disc. So this is where it's pushing out, and this is now where the jelly-like structure has gone out completely. And quite often in these cases, they will remove this disc, okay, and then they'll just fuse these two bones together. Your back will be a little bit stiffer, but you don't have the pain. So thinning disc, okay, again, age related. If you don't drink enough, you're dehydrated, you don't eat well, you're not moving, you're not active, you can get thinning discs as you get older. And here we've got disc degeneration, which is this one, with an osteophyte. So an osteophyte is external bone growth. Now if you can imagine, this part here would move smoothly, yeah? If you've got lumpy bone here, okay, so this is arthritis, by the way. So if you've got lumpy bone here, then you're obviously going to get pain as this bone rubs against this one, okay? Or you can't move because the bony processes stick out to the side, so you get very stiff back. So what are the risk factors for lower back pain? Well, being older, your lifestyle, your health, your well-being, your nutrition, your posture, and being overweight I would say being overweight creates more pressure onto the back, and usually people who are overweight tend to be more sedentary. Being thin doesn't mean you're excluded from having back pain, because I get as many thin people having back pain as I do with overweight people. It's just that being overweight exacerbates it further. Stress, okay, and that's because of lots of different issues that we talked about with cortisol, the effect on you know, and when you're stressed, there's so many things around stress, why stress, but really tension in the muscles, not eating well, not sleeping well, not recovering, having an accident, blah blah blah. So what are the consequences of lower back pain? And it's really interesting. I haven't even talked about chronic pain and how chronic pain affects you. This is more like when somebody has a back pain, their ability to recover and deal with it is very personal, based on their motivation to change, their acceptance that they can get better, their ability to proactively follow exercise and nutrition advice. And what they call is a lot to do with what's socio-economic factors. So if you have stress in your life and you have back pain, you kind of think like this is part of stress, so you won't do anything about it. You know, if you have a job where you're fairly sedentary, then you know you're not moving about and you need to keep active and keep moving. And what was really interesting, and I've taken a lot of this out, is that stress and pain and ability to deal with it is a lot more psychological than we used to think. So let's have a look at why exercise is good for you. Number one, it really helps you come back to normal activities. It reduces the length of time that you're in pain, and it extends the length of time between episodes of pain. So sometimes when you have a back issue, it comes back time and time again, but when you exercise on a regular basis, you recover from that much quicker and you have bigger gaps between. So I get a lot of people in my back care class who walk in happily because they know if they don't come to class on a regular basis, they have back pain. So sometimes they come to class, they feel better, they leave, they go, well, I'm cured, and then they have back pain, and then they come back. And then once that's happened 2 or 3 times, they just come to back all the time, because they know when they come to Pilates on a regular basis, they're less likely to have back pain, and if they do have back pain, they recover quicker. What's interesting is that they're now starting to see that group exercise classes, or being accountable and doing the exercises yourself, are just as effective as going to the physio. Okay, so there's a link between these psychological factors and back pain, and the onset of pain, of how you think about it and how you deal with it, helps your recovery or doesn't help your recovery. Stress, anxiety and mood are significant factors. So, you know, you could do with a whole new course just on you know, chronic back pain. But having had chronic pain myself, I just didn't believe it until I went through it, and now, and having read and listened to it, is very, very interesting about how if you think you're in pain, you're more likely to be in pain, or if you've had a pain, even when you're cured, when your back is better, you'll still behave as if you've got a bad back. Anyway. So chronic pain, so you can have an acute phase that leads to being chronic because of your psychological issues and not because of any physical issues. So some of the things that people put in their ways, they kind of go like, well, I can't do that because I've got bad back. Okay, so we curtail activity, stop doing some of the things that would be good for them, narrow down what they do, how far they walk, how long they're active, reduce their range of movement. All of these things then become a physical barrier. Motivational barrier, oh, well, I've got bad back. Or you are scared of having that pain again, and so it's very difficult to get motivated. And again, emotionally, you know, I'm not saying this is for everybody, but some people like the fact that they've got bad back so that they can use that as an excuse to get out of doing things. I'm not saying about work, but, you know, sometimes like, oh, well, I can't go dancing because I've got a bad back, or, you know, I can't wear high heels because I've got a bad back. I mean, probably high heels cause a bad back, but any kind of emotional attachment to back pain is fascinating for me. Then people say, like, look, I haven't got time. I haven't got time to do back exercises. I'm really busy. I mean, to me, time is the most frustrating thing because everybody's got time. It's just the prioritizing of your time. If something happened today and you had to go to the doctor, you would find the time, but people will put off doing exercises, will put off doing Pilates because they say, I just don't have the time. What we're saying is, I just don't prioritize exercise. And then there's availability. You know, we're working online and I've been a back care teacher, but there's not that many back care classes around. But also you might find now, especially with, you know, the situation we're in at the moment, you might not find a class near you that you like. I'm going to skip to this because I'm going on too long. And I'm just going to say, I hope that you enjoyed listening to some of the postural issues around back, and to think about how lots of different elements of your life come together to help you with back pain. You've got to eat well, you've got to reduce your stress, you've got to sleep well, you've got to have enough hydration, you need to be active, you need to work on core and strengthening those muscles around the back that hold it into position. You need to look after your pelvic floor, and really to have a positive mental attitude where you think like, well, you know, let's just be logical. If I broke my leg, I would expect it to heal. But if I pull a muscle in my back, I think I'm lumbered with a back pain forever. It's not the case. Okay, so keep working at your Pilates. Don't over push yourself. Just be consistent, turn up, do the work, set aside the time. Now, if you can't afford half an hour, even 10 minutes will make a difference. Okay, hope you enjoyed.